1. Tell us about yourself and your perioperative experience. Why they ask, icebreaker plus quick summary of clinical background, perioperative exposure, and communication style. Indeed +1. How to answer, structure. Current role plus years of experience. Perioperative areas, pre-op/scrub/circulating/PACU. Main specialties, e.g., general, ortho, gynae, ENT etc. 1 or 2 strengths relevant to theater, teamwork, safety, attention to detail.
Sample answer. I am a registered nurse with 8 years experience, including the last 5 years in perioperative services. I have worked as both a scrub and circulating nurse in general, orthopedic, and laparoscopic surgery lists. My focus is on maintaining a safe, well-organized theater, supporting the surgeon, and advocating for the patient, especially when they are anesthetized and vulnerable. Colleagues describe me as calm, systematic, and dependable in emergencies.
2. Why did you choose perioperative/theater nursing? Why they ask, to see motivation and long-term fit in a high-pressure, specialized area. Nurses.co.uk+2.
Sample answer. I chose perioperative nursing because I enjoy being part of a highly coordinated team where every small action contributes to a safe surgical outcome. I like the combination of technical skills, strict infection control practice, and patient advocacy during a time when the patient cannot speak for themselves. It is satisfying to see a patient come into theater anxious and later wake up safely in recovery, knowing that our preparation and teamwork made that possible.
3. What qualities are important for a perioperative nurse, and how do you show them? Key qualities mentioned in job ads and interview guides: attention to detail, aseptic technique, communication, teamwork, calm under pressure.
Patient advocacy. Resources.workable.com+3.
Sample answer. I believe the essential qualities are vigilance, technical competence, clear communication, and respect for the multidisciplinary team. I demonstrate vigilance by performing thorough checks before every case: patient ID, consent, site and side, implants, and equipment. I am very structured with my count procedures and documentation.
4. How do you prepare a patient and family for surgery? Why they ask, pre-op assessment, education, and anxiety management are core perioperative responsibilities. Insight Global +2.
Sample answer. Steps. In pre-op, I start by confirming identity, procedure, consent, allergies, NPO status, and baseline observations. I review their history, medications, and any investigations relevant to anesthesia. Then I explain what will happen step by step: transfer to theater, anesthetic process, and what they can expect in recovery. I use simple language, invite questions, and assess their level of understanding. If the patient or family is anxious, I acknowledge their feelings, provide reassurance, and escalate any concerns to the anesthetist or surgeon as needed.
5. Talk us through your role in the 3 perioperative phases: preoperative, intraoperative, and post-anesthesia. Why they ask, to check understanding of the whole perioperative journey, not just scrub duties. Insight Global +1.
Sample answer. Short, phase-based. In the preoperative phase, I focus on assessment and safety checks, documentation, consent, fasting, allergies, site marking, and patient education. In the intraoperative phase, as a scrub or circulating nurse, I maintain sterility, anticipate the surgeon's needs, manage instruments and counts, and document key events such as tourniquet times, specimens, and implants. In the post-anesthesia/immediate post-op phase, I hand over to PACU using a structured tool like SBR, highlighting airway, analgesia, antiemetics, blood loss, drains, and any concerns. I ensure that the patient transitions safely to recovery with clear instructions for ongoing care.
6. How do you ensure correct patient, procedure, and site in theater? Based on WHO surgical safety checklist and/or interview guides. Nurses.co.uk+2.
I strictly follow the WHO surgical safety checklist and local policy. Before induction, I participate in a timeout, confirming the patient's identity, procedure, site and side, consent, allergies, and any critical concerns with the whole team. I verify this against the consent form, wristband, and theater list. Before incision, we repeat key elements, including antibiotics and VTE prophylaxis. If anything does not match, I speak up immediately and stop the process until it is resolved, regardless of who is in the room.
7. How do you maintain a septic and sterile technique? What would you do if sterility is breached? Why they ask, infection prevention is a top priority in perioperative roles.
Sample answer. I ensure sterility by following standard theater protocols, proper surgical hand scrub, checking packaging integrity and expiry of sterile items, maintaining a clear sterile field, and positioning drapes carefully. I avoid turning my back on the field, keep movements organized, and challenge any breaks in sterile boundaries. If I notice a breach, for example, a non-sterile object touching a sterile field, I immediately state what happened, remove the contaminated item, and re-establish sterility, even if it causes a brief delay. Patient safety is more important than theater time.
8. Describe a time you supported a very anxious patient before surgery. Frequently listed as a behavioral OR nurse question. Resources.workable.com+3. Answer using STAR, situation, task, action, result. Situation, briefly describe the patient and the planned surgery. Task, your responsibility was to prepare and calm them. Action, listening, explaining, involving family, using simple language, liaising with anesthetist. Result, patient was calmer and surgery proceeded smoothly.
Sample answer, compressed. A middle-aged patient scheduled for bowel surgery was extremely anxious and kept saying he might not wake up. My task was to complete pre-op checks and support him emotionally. I sat at eye level, acknowledged his fears, and explained what the anesthetist and theater team do to monitor him continuously. I encouraged him to voice specific worries so we could address them one by one, and I asked his wife to stay until transfer. By the time we reached the anesthetic room he was more settled, and later thanked us for taking his anxiety seriously.
9. Tell us about a time you identified a problem or inefficiency in the operating room. What did you do? Frequently appears in OR nurse interview templates. Resources.workable.com+2.
Sample answer idea. Describe e.g., missing instruments, poor stock layout, or delays due to communication. Sample answer. In one theater, we regularly lost time because the laparoscopic tray was not standardized, different instruments were added ad hoc. I started documenting which items were actually used and discussed this with the charge nurse and CSSD. Together we created a standard laparoscopy set and updated the count sheet. This reduced setup time and made counts more reliable, which improved flow and reduced stress for the whole team.
10. Describe a conflict with a surgeon or colleague in theater and how you handled it. Common behavioral focus in multiple OR interview guides. Resources.workable.com+3.
Sample answer. During a busy list, a surgeon became frustrated when I insisted on repeating the instrument count after an unscheduled change in scrub staff. He felt it was wasting time. I calmly explained that policy requires a full count after any change to ensure no items are retained, and that I was protecting both the patient and the team. I completed the count efficiently and the procedure continued without further issue. Later, I debriefed with him privately, acknowledged the time pressure, and suggested we plan counts proactively when lists run late. Since then, he has been more supportive of safety checks.
11. How do you handle stress and stay calm during emergencies or long, complex cases? Frequently mentioned in OR nurse interview content. Insight Global +3.
Sample answer. In emergencies, I fall back on preparation and routine. I focus on my immediate priorities, airway and hemodynamic stability, ensuring emergency equipment is ready, calling for extra support early, and keeping the sterile field organized. I consciously slow my speech and confirm orders back to the anesthetist and surgeon to avoid errors. After the event, I participate in debriefs and reflect on what went well and what we can improve. Outside work, I manage stress with exercise and adequate rest to avoid burnout.
12. Tell us about a clinical incident or near miss in theater and what you learned. Why they ask, they want openness, reflection, and learning culture, not perfection. Sunbelt Staffing +1.
Sample answer, outline. Brief, non-identifiable incident, e.g., almost wrong implant, incorrect antibiotic dose, sponge count discrepancy. What you did immediately, escalated, stopped procedure, rechecked. How the team resolved it. What you changed in your own practice. Mini example. We once had a discrepancy in the swab count before closure. I spoke up immediately, and we paused the closure while we recounted and searched the area. We found the missing swab attached under the drapes near the suction tubing. Afterwards, we updated our practice to keep used swabs in dedicated, clearly visible trays and to limit non-essential staff movement during counts. It reinforced for me that speaking up early is critical, even if it feels uncomfortable.
13. How do you manage communication and handover between ward, theater, and recovery? Why they ask, continuity of care and structured communication, e.g., SBR. Insight Global +2 inch.
Sample answer. I use a structured format like SBR for all handovers. When receiving from the ward, I clarify diagnosis, allergies, fasting status, medications, and any psychosocial issues. In the theater record, I document key intraoperative events like blood loss, difficulties with airway or intubation, and implants. When handing over to PACU, I summarize procedure, anesthetic given, analgesia and antiemetics, drains and dressings, and any concerns. I always check that the receiving nurse has understood and invite questions.
14. How do you manage pain, nausea, and early postoperative complications? Why they ask, immediate post-op safety and comfort are major quality indicators. Insight Global +2.
Sample answer. Pain and nausea are expected issues, so I ensure that multimodal analgesia and antiemetic plans are clear in the orders. I monitor pain scores and vital signs closely and escalate if pain is not controlled or if there are signs of respiratory depression or hypotension. I also assess for early complications such as bleeding, airway compromise, or urinary retention, and respond according to local protocols. Education is important too. I explain to patients that reporting pain early helps us manage it more effectively.
15. How do you handle unrealistic or demanding requests from patients or families about surgery? Why they ask, many or guides ask about dealing with unreasonable requests or expectations. Insight Global +1.
Sample answer. I start by listening carefully and acknowledging their concerns. Then I clarify what is clinically realistic and what the surgeon has explained, using simple language. For example, if a family demands that a relative be placed first on the list, I explain how theater scheduling works and why we must prioritize based on clinical urgency and safety. If tension continues, I involve the senior nurse in charge or the surgeon to help address expectations while maintaining respect and confidentiality.
16. How do you keep your perioperative nursing knowledge and skills up to date? Based on common nursing interview questions about professional development. Incredible Health +1.
Sample answer. I regularly review hospital policies, national guidelines, and updates on infection control, instrument reprocessing, and safe surgery checklists. I attend in-service training, morbidity and mortality meetings, and any theater-specific education such as new equipment training. I also complete online courses and read perioperative journals to keep up with best practice and new techniques. When I learn something new, I share it with colleagues, for example by presenting a short in-service during staff meetings.
17. Why do you want to work in this hospital/perioperative department? Common in theater nurse interviews. Nurses.co.uk +2.
Sample answer. I am interested in this perioperative department because of its reputation for complex multidisciplinary surgery and strong focus on patient safety. I have read about your use of enhanced recovery pathways and your low infection rates, which align with my values of evidence-based practice and quality care. I am also attracted by the opportunity to develop my skills in, e.g., orthopedics, cardiac, robotics, and to be part of a supportive, teaching-oriented team.
18. Where do you see your perioperative career in the next 3 to 5 years? Frequently listed among core nursing interview questions. Indeed +2.
Sample answer. In the next 3 to 5 years, I aim to become an expert perioperative nurse in my specialty, possibly taking on a resource or preceptor role. I would like to complete additional training such as a perioperative nursing certificate and be involved in projects that improve theater efficiency and patient safety. Longer term, I am interested in roles such as theater coordinator or clinical nurse specialist, while still keeping direct contact with patients.